Hi, and welcome to another episode of Hot Takes with me, the Silver Fox. And in this era when the NHS is falling apart at the seams, budgets are paper thin, and patient care is at an all-time low, it is at least reassuring to know that the ban on woke jobs is being completely ignored, with 12 roles paying a total of over £500,000 are still being advertised. Why? Surely that money would be better spent on nurses and medication. But no, it's more important that we have diversity and inclusion managers. It's the NHS. They're not caring for patients anymore. They're just making sure that diversity targets are met. Madness. Let's look at this article. And the headline says it all. NHS chiefs ignore ban on woke jobs with well-paid equality, diversity and inclusion roles still being advertised 2 months later. In June, then Health Secretary Sajid Javid said the NHS had too many diversity jobs, and it still does. However, NHS bosses are still advertising a dozen well-paid jobs like this. Together, the 12 jobs will cost between £474,000 and £540,000 a year. That is a lot of nurses. You know, in an organisation that is desperately short of nursing staff and care staff, anything like that, and they're pissing it away on wokery and inclusion staff because, hey, that's more important than actually getting people cured. So in early June, the Health Secretary, Sajid Javid, launched a stinging rebuke at the NHS top brass, saying there were too many working in roles focused solely on diversity and inclusion, and we must spend every penny on patients' priorities. Currently, there are 12 EDI roles advertised on the main NHS Jobs website, all posted within the last month. So since the ban, the three have salaries that could top £60,000, 8 paying at least £40,000, and together the jobs will cost, as I say, around £500,000 or so pounds. Some of the posts advertised serve overwhelmingly white areas. They include the head of equality, diversity and inclusion at St Helens and Knowsley Teaching Hospital NHS Trust on the outskirts of Liverpool, which will pay £56,000 to £65,000. The trust serves 360,000 people in a predominantly white working class area, and its latest annual report states our communities are not ethnically diverse but do have high levels of deprivation. Yeah, so you're getting a diversity officer into an area that's not diverse. What's he going to do? Phone up somebody and say, "Oh, can you ship me in half a dozen black people, 3 Asians and a Chinese?" You're going to bust them into the area just so he can hit his targets. You have to cut the cloth you've got. You have to deal with the situation you're in. There's no point having a diversity manager in a white area. Cumbria, Northumberland, Tyne and Wear NHS Foundation Trust, which provides mental health and disability services across the North East, is seeking involvement and lived experiences diversity officer. What the hell is that? It's paying £40,000 a year, a lived experience diversity officer. I don't know if anyone's been to the North East, but let's just say it is white. It's white. Anything other than white is very, very rare. The advertisement states it wants to develop a workforce in our services that are inclusive, equitable and reflective of our communities, including race, religion, sexual orientation, age, disability and gender. Well, in that case, you're going to have a white workforce because it's the whitest area of Britain. The North East, there you go. The North East is the least ethnically diverse area of England's 10 regions. 95.3% of people who are white. The Chief Executive, James Duncan, says this post will reach out into communities across the Trust to ensure we are inclusive and ensure a contribution from all the communities we serve. How about doing a better thing than that? I mean, it's just my mad idea, right? But how about being slightly better for the communities you serve by, I don't know, treating the patients, making sure people are cured of whatever ails them, or given the right amount of medication, or having sufficient nursing staff to ease their torment. Surely that would be better for all concerned than making sure that the ethnic mix-up of your hospital matches what you think it should be. Madness, I know, for a hospital to actually kind of, cure people, treat them, sort them out when they're ill, fix a broken bone. Madness, isn't it? I mean, obviously all that money and time and effort must be spent in middle management ensuring that there's enough non-white faces seen around the hospital from time to time. And £500,000 being pissed away on this. It's unbelievable. Cornwall Partnership NHS Foundation Trust is after an ED&I engagement coordinator, whatever that is, who is passionate about inclusion and diversity and is paying up to nearly 40,000 as well. Cornwall is 98% white. So I think the big job this man's going to have to do is to go to London, buy train tickets and get some black people in London to go down to Cornwall to get treated or something. These people are mad. But the worst thing is they're pissing away £500,000 on shit like this. Shit like this that could be used to save people's lives, to, ease the comfort of a man lying in bed, to help a woman give birth a little bit, more comfortably. There's many different ways in which £500,000 could be spent. Certainly not on this. We need to fire these managers. We need to fire every diversity, inclusion manager, everything. Get rid of it all. We don't need them. They're a waste of money, and the money should be better spent in looking after patients. Anyway, that's my view on it. Don't care. Coming up, rounding off. So who's making the decisions to allow this to go through? The budgets are tight. Somebody must sit there, look at these budgets, see how tight they are and go, yeah, but we can still pour away £40,000 a year or £60,000 a year or £80,000 a year on these roles. Stop all the roles. And the ones you've already got, get rid of them. The savings will be enormous and it would make such a difference to patient care. And while you're at it, get rid of a few other managers. There's a lot of management in an NHS hospital that really doesn't need to be there. Anyway, if you like what you see and hear on the channel, please hit the subscribe button if you haven't already. Ring the bell for notification of future output. Leave a like, leave a comment, please share the video. And until next time, stay safe, stay well. Don't go to hospital if you don't need to. And goodbye.